All right. Hello, everyone, and welcome back to another episode of the Coded Switch. I am your co-host, Dr. G, here with Toltu the Psychologist. And today we're going to get into, as promised, the latter discussions of imposter syndrome and continued discussion of what we started before. And today specifically, we're going to get into really sort of, does it ever go away? Does it ever dissipate? Does it ever get any better?
What are you
So we'll
talking about? Is that my lunch?
so we'll dive into all of those topics. We hope you stay with us and join us for the whole episode.
Welcome to the Coded Switch podcast, a deep discussion about the experience of intersectionality and vulnerability as it relates to wellness, hosted by Dr. Galaniga Machisa and Toltu the Psychologist.
Welcome back to everyone. If you're wondering what we're talking about, we're not talking about my lunch. We're actually talking about imposter syndrome. You know, that feeling of self-doubt that you're like, oh, am I meant to be here? Is this really for me? Everyone's going to know that I'm actually a fraud. It's not the real deal. Everyone experiences it from everyone to everyone, really, except for perhaps some narcissistic people who are like, hey, I'm totally up for this, which I think we need to be, look, let's be fair and friendly. Confidence is an amazing thing.
Certainly.
Narcissism is something different. However, there is sometimes you just get that, okay, maybe I'm not the right person for the job, which is, I think it's normal, but when do you think it might be a problem?
Absolutely. I mean, yeah, I think it's something that we touched on last time about like this, we sort of dissected it a bit, and we're talking about specifically because we were talking about the issue of faking it till you make it, right? That saying,
Yeah.
and getting specific about what we're faking in that. It's not necessarily, it's not the qualification, it's not the training, it's not the readiness. What's being faked is the confidence. And then going
Mm.
into like, why would somebody need to fake confidence? What is it about, right? How we are perceived and judged that makes one sort of feel like they need to project that quality, even if it's not there organically at the start of whatever. And that's usually how it goes, because of course you gain confidence with experience, but experience takes time. So yeah. So I mean,
What if you have the experience? That's the other thing.
right. Well, the hope is that with experience, you at least you become a little more comfortable in whatever you're doing in the role, at least. And I mean, it has a lot to do with just like how our brains work, really, right? As
Yeah.
far as when there's a learning curve, when you're learning something new, there is an inherent period in that learning where you are a little bit more apprehensive. Like the brain, especially the prefrontal cortex, it likes order, it likes to place meaning and understanding. We like predictability. And so when you are learning something new, obviously there are a lot of unknowns, and your brain sort of goes into um, hyper awareness, like hyper vigilance almost, where you're sort of trying, anything could mean anything, something in your environment. And so in trying to understand that, you dial in, you become more alert. And that doesn't feel good. There is a stress response that happens as a part of it. When you be in that vigilant state, you are sort of using your stress hormones like cortisol, adrenaline, noradrenaline, and
Yeah.
so that it's very hard then when you're in that sort of fight or flight mode to have the calmness and the presence of mind to invoke your knowledge, your knowing, right? And so it's something that is a very natural and normal thing that's part of a learning process, but oftentimes we don't give each other the space to,
Yeah.
right, to have that unfold naturally. It's almost expected, like, you if you know what you're doing, you shouldn't have any sort of apprehension, or there shouldn't be a learning curve, or I mean, it's something that it's a standard that we hold each other to, really.
Mm.
I think that's safe to say. But I mean, and everyone's experience of taking on a new role, or um, I mean, obviously, if we're talking about like being involved in or holding a role for a long period of time and still experiencing that, then it may have to do with the apprehension of how you are, if there's some dynamic about how you are being perceived, and you're worried about how you're being perceived because of things outside of your control, like your identity, your right, like ethnicity. There could be things that make you a little more self-conscious, that even after adapting to a situation or a circumstance, you still feel that sense of right, like just not feeling quite comfortable, or like you're being taken for the expert, or the with the knowledge that you have, right? At least that's how I'm thinking about it. I don't know if that resonates or not, but
Definitely, and I think there's a different dimension to that too. Sometimes you do feel confident. You know you're the right person for the job, but the situation that you're in makes you question yourself.
yeah,
And so that shows up as confusion. Am I really the right person for the job? I know I can do this, but no one else thinks I can. Maybe I'm not cut out for this anymore. And I
that's
think
right. Yeah, that's exactly
that's
what I was getting to, and I think you said it more poignantly in that there's some likely something about the dynamic going on around you that's causing that second guessing of like, well, do I really know? Right? Or
yeah,
I
yeah.
mean, I just to speak plainly, what I experience very often, and maybe you share in this experience as well, is being a woman of color. In a what used to be, I can say what used to be a male dominated field. I think it's changing now, in medicine and as a physician specifically. But being perceived as sort of like always the question of, does she really know? Does she really know it? Right? Like, and I know that maybe that's something that was very real for a period of time, but now that I've been doing this for approaching a decade, right, and I've at least proven to myself and feel confident within myself, but every time you engage with a new person, there's still that wondering of, I wonder if they're thinking this, right? At least in
You've
my
had so
experience.
many you've had so many experiences of that.
Yeah. Oh, certainly. I mean, especially during like the training period of right going through medical school and residency, there's something about not yet having the title, right? I think
Mm,
that just as human beings, we afford a lot more respect when there's a title involved, right?
mm.
Rightfully or not. I don't know. I mean, I'm not gonna maybe be the judge of that, but during the training period, there's definitely the assumption that I couldn't possibly be the medical student or the resident, right? Like
Yeah,
I must be the nurse, or I must be I must be the
yeah.
tech, or whatever, some other,
Everyone else but the
everyone
actual
else
role.
but exactly the physician. And having those, they didn't happen often. I'm not going to exaggerate or anything like that, but when they did happen, it would it would reinforce maybe the perception that I internalized from my
Mm,
experiences growing up as a woman, as a girl of color, a black girl, and then internalizing that in my adulthood to think like, I wonder if this person is second guessing me, or is doubting me, so I think, and it might not be specific to the experience that I lived at. It might have to, I'm sure it maybe crosses and reaches into other avenues, other areas of experience. But
yeah.
specifically, speaking to what I know, it's something, and it does, like I said before, it doesn't happen very often now, but every once in a while I'll encounter maybe somebody of a certain generation, or someone of it, you just wonder like, I know
But
it's
that's
2023,
not
but I wonder if they've caught up.
honestly, it doesn't. The thing is, it's not about frequency, is it? It
Mm,
only needs to happen once. It only needs to happen a couple of times for it always to be in your head.
yeah,
And how many people listening or even thinking about, our own life experiences, you've seen that look. You've
yeah,
seen people don't have to say things to you. It's about not being afforded the opportunity or feeling like you're the token person that you've got to somehow show up. Like you
yeah.
get a seat at the table, but where on the table are you sitting? You're not
Hmm.
at the head, you're not at the middle. And so sometimes I feel like, and here's the thing, like I know we're talking about imposter syndrome, but part of it is when you're being made to fit into something that wasn't created for you.
Right.
And I think that's a reality that we also need to speak to as well, because the reality is, there are places that are not designed for women. There are, places designed not for black people, that are designed just for a certain prototype.
Right.
And if you don't fit into that, then yeah, you're made to feel like you're the one with the problem. So I think also like and it comes to, I guess, thinking about, does it ever go away? I think that's what we were mentioning at the beginning of the pre-episode. Does that stuff go away? It doesn't. It really doesn't. Like, it's how you manage the situation and how
Yeah.
you perceive it, because the way you perceive will determine what you do. And so there are people who are movers and shakers who say, I'm going to go and change this. And there are others who are like, I don't want part of this. Like,
Yeah. So,
just take me out and put me into my own space. And
yeah.
I'm curious which one you are. Like, I know what I am for myself. I'm like, man, I just tapped out after a while. I'm like, I'm not going to sit here proving myself to people, knowing what I'm good at. I'm just going to create my own space.
Yeah.
And I did. And now when people come to me, it's on my terms. Like, I
Yeah.
know I'm good at what I'm doing.
Right.
And when people invite me and I feel like, oh, am I getting the vibes that I'm not welcome or that I'm being second guessed? Then, that's when, sometimes you do need practical strategies. All right, what is it that we do? But I guess I'm interested for you, what your take has been on the experience.
Yeah,
What have you
absolutely. I think,
done?
yeah, certainly. No, in my experience, I can say, as far as like the does it ever go away, I agree. It doesn't go away completely, but it does become less frequent, at least in my personal experience, and it probably has a lot to do with what you just explained about like reaching a certain point where you're like, it is what it is. This is, like, I know what I know what I know. I don't know what I don't know. And, that is, it's not static, right? That is not a static reality. Of course, like, I mean,
It doesn't make
you're
you
always,
unwelcome.
what's that?
It doesn't make you unwelcome, like
It
not knowing.
certainly doesn't, but I mean, I think it has something to, I mean, this gets really, really deep into human psychology, I think. And this, I mean, this is your realm of things, but, has a lot to do with our ego and sort of needing to feel a certain way around certain, right? It has a lot to do with that, as far as like what we project of ourselves and what we project onto other people and those sorts of dealings. But I mean, I echo a lot of what you're saying. It's something that is a process that is happening for me, I think, more recently, and just understanding that, like, hey, right. I mean, life is it's finite, right? And so we have a finite amount of time on this earth, and so you can choose to live in a way that leaves you in the lurch all the time, or you can say, you know what, I'm breathing the same air, I'm living the same experiences for the most part. And so you deserve to have your niche in your space, and I think, like, for me, that's been something that's been more recent, but just coming to the realization that I do need my own lane, right? I need my own lane to be able to express my experiences, my perspectives, my, you name it, without, and it doesn't mean, it's not like in the avoidant kind of way, like avoiding, disagreement. Okay, well, someone disagrees with how I think, so I'm just not going to include them. I mean, I don't think that's helpful either. But also, I mean, you can use up a lot of unnecessary bandwidth on, right, and a lot of unnecessary energy on dealing with that, troubleshooting that issue, the issue of, like, being just things that are completely unnecessary if you take the big picture of life, of like being unwelcomed, or being made to feel unwelcome, or anything that sort of cuts down at a person. Right. It's just unnecessary to experience. It's something that happens in social situations, as we try to, like, make
everything.
Absolutely. It's something that happens, I think, because it lends itself to something deep within our psyche about needing to, needing hierarchy, and like needing to know where you fit in, and trying to gauge yourself and measure up against others around you. I mean, anything that the bottom line is, anything that cuts away at the confidence of another human being is just not worth anyone's time. It's just not, so.
And it's so easy to say once you've had those 10 years of experiences, but when you were that intern, when you were, the new doctor on the block, and I think, here's the thing, I work with quite a few doctors, and a lot of them come to me, believe it or not, for anxiety.
Yeah,
and
certainly.
so, you can imagine imposter syndrome and anxiety, plays into one another. But also, if you've got this idea that you don't want to be criticized because the work that you do is so important, that if people put you down, that's like life and death for some people. So they don't want criticism at all. They don't want to be questioned at all, because a big criticism, small criticism, we just sort of amalgamate it into one. So even the smallest feedback can make someone feel completely crushed. And I think as a medical professional, as in from my experience, treating doctors, is that what they'll do is they'll be so rigid, right, about what should happen and what expectations of them are, to the point that they're allowing people to set boundaries for themselves. And so all of a sudden other people are choosing whether you're good or not. You get a 360, evaluation, and like you get some negative feedback, and people tell you all these great things, you focus on the negative stuff, which you can, but you shouldn't allow that to overtake you either. It's what you do with it that matters. What you do with the critique matters. What you do with the story that you tell yourself matters, because the stories will just keep coming to you. It's what you do with it. And I think that's what's missing from a lot of the conversation around imposter syndrome.
Absolutely. Absolutely. I think, it's interesting. This past week, I was having a discussion with a patient who, we weren't talking about her specifically, but a family member of hers is also a physician, and was, she was, as we were doing family history, was telling me about sort of, just the things that her family member deals with being a physician, and sort of what it's brought out of them, and how, like, their approach to life. And I was telling her, because I resonated with a lot of it, first of all, right? I resonated with a lot of what she was saying about her family member.
Me too,
and I was just like, you know what? I think let's level here. I think there is, and of course I did some reflection on this as well afterwards, there is a profile of a person, right, who is drawn to the medical field. There is a profile. And I think within that profile, there are certain personality traits that might lend someone to be more susceptible to, to criticism, right? Because, and then the culture of the field is also something that is really, really important to, anyone who practices medicine I think, at least in your training, maybe not like once you go into your specific discipline, it might vary as far as the level of risk that is inherent to the work that you do. Obviously, for some, for like surgeons, it's really high. The level of, the risk that they're dealing with on a daily basis versus, someone that's maybe just doing, talk therapy or something like that. There's still things that can go wrong, but the risk of, like, to life and limb is not as dire as it is among surgeons. But still, like, there is this ever present understanding that especially during training, that there are things that you can do or not do that can significantly affect a human being's life. Right. And so I think that's the starting point. We're all starting from that starting point. And because of that, and this probably exists with people, with maybe pilots, or, people who hold people's lives in their hands with their daily responsibilities. It sets up sort of an atmosphere of just no excuses, no room for error, and of course that's inconsistent with being human, right? It's just we would love to have no error. It's a lofty ideal.
And I think it literally, on that point, there's rupture everywhere. The question is how you repair it. So even if someone's coming in on a stretcher dying, how are you going to try and repair that? And I think sometimes, there's not enough conversation about that. Maybe more so in, like, up and coming generations of, like, physicians. But, for most people, even like physicians have personal lives too, right? So sometimes it's not about it's about sort of recognizing that you can repair a lot of situations, even if it's not ideal.
Yeah.
And so that idea of, I'm not good enough, therefore I'm not going to try, therefore I'm going to be so anxious, therefore I'm not going to do anything at all, really just feeds into that stereotype that's been placed about you. So definitely there are things you can do about it, but I think let's be really upfront about how debilitating, like, imposter syndrome can be, particularly if it's affecting your career choices, your friendships, whether you speak up or not,
That's
in
right.
your relationships.
Yeah, absolutely, 100%. And I think, like I said, I think that as human beings, at least if you are introspective and you take the time to gauge what's going on with yourself, right? You start to reach a point where it feels like it's demanding too much, right? It's demanding too much energy, too much thought, too much bandwidth to have to consider all the things that, like what you just mentioned, that someone who's sort of living out and feeling imposter syndrome is feeling. And so that's I would hope at least is part of the reaching a certain point and just not having the energy to do it anymore. And so like just coming to the understanding that there has to be another way. There has to be another way of getting through. Like I always doubting, always questioning, second guessing, self-censoring. That has to stop. It's at least, I mean, like I said, this does require a certain amount of, it does require a certain amount of introspection. So if that's not present in someone, then it's going to be a lot harder. Certainly. It will certainly be a lot harder to reach that place and that point. But if there is even just a little bit of like, just the understanding or the feeling that like when I'm around this dynamic, it doesn't feel good, right? It doesn't feel, what's not feeling good about this? What is it? Right. And asking the questions, asking, why 5 times. They always say, like, to get to a root cause, you ask 5 whys. Yeah. Well, why is that? Well, why is that? And then hopefully like lead to an understanding of, okay, well, it's not, and this doesn't mean that as individuals we couldn't possibly have any room for improvement, right? Of course we do. And there is a role for constructive criticism and trying to suggestions or perceptions that are in really good faith, trying to help someone to become the best version of themselves. There is space for that, but when it's simply sort of like just a dynamic that is continually, and of course, I think what we're skirting around here is power dynamic, right? That's a big part of everything that we live out, whether it's in your personal relationships or professional relationships. Power dynamic is it's real. It's right. It's real. Exactly. And so we probably have to do an episode on that. Something just really.
Okay. We'll get your sister to cut that bit out. I think we should continue this conversation and maybe do a part on what to do. If you're overwhelmed by these feelings of I'm not good enough, or I'm not going to apply for the job, or I don't know what to say back, or I know what to tell them, but something's just stopping me. There's definitely a way around that, and I think we should give that some space as well.
I think you're absolutely right. So we're just about out of time for this episode. Thank you so much, as always, for joining us on another episode of the Coded Switch. So next time we'll dive into things a little more deeply as it relates to everything that Toltu just mentioned. And of course, look out for more episodes on Apple, Spotify, Stitcher, and other major outlets for podcasts, as well as YouTube if you'd like to see our faces.
We've got something for everybody. All right, we'll see you next
time, folks.